Hello, everyone. My name is Anthony Jones, and today we'll be examining Leon County and Tallahassee, Florida, and their response to COVID-19. This presentation will briefly discuss local policies, emergency funding, federalism, social justice, and also include critiques of the county's actions. My presentation will cover some of the challenges associated with COVID-19. Then we will examine federalism's role in crisis management. It is important to note that Leon County was able to tailor their responses to COVID-19. And a lot of the times, the county's measures often differed from Florida state policies, which effectively highlights federalism in action. The key concepts for this presentation would be devolution and laboratories of democracy. Now we're going to examine some emergency funding allocations. Leon County received a total of $51.2 million in CARES Act funding. These funds were allocated to small business relief, public health initiatives, and social services for vulnerable populations. This federal funding supported Leon County to effectively address some immediate pandemic challenges, and it highlights the importance of financial support in managing a local crisis. Now we'll examine some of the policy domains and key actions of Leon County during this time. The first, mask mandates and social distancing requirements, limited indoor gatherings, expansion of healthcare infrastructure, and focus on balancing public health and economic recovery. During this time, there was a great amount of tension between Leon County's local policies and Governor Ron DeSantis' directives for the state. Leon County was one of the few in Florida that decided to put an emphasis on health and safety despite the state pressure to reopen quickly. Public comments and community impact. The first element I would like to speak on is the divided public opinions during board meetings. A vast majority of Leon County was split down the middle, with one half being supporters of health measures versus advocates for fewer restrictions. And the third element would be the economic struggles of small businesses due to the prolonged restrictions. Leon County's policies were heavily influenced by community feedback, which only emphasizes the challenge of balancing public safety with economic realities. Now on to federalism and devolution in action. Starting at the top, we have the federal government's role, which included funding and providing resources. Down to the next level would be the state government's role, which was to issue broad directives for the counties to follow. Then on to Leon County's autonomy, which enabled them to tailor policies to the local needs of their population. And lastly, laboratories of democracy, which included innovation at a local level. Social justice and equity. In regards to the pandemic's disproportionate impact on minority populations, Leon County attempted to mitigate these effects by first addressing racial and economic disparities in all health outcomes. Next, providing and funding a targeted vaccination campaign for underserved communities. And lastly, providing an allocation of resources to address systemic inequities. Now we'll examine the political administration dichotomy, which include three elements. The first being tensions between state and local governments, being that Leon County was one of the last Florida counties to fully reopen despite state directives. The second, local resistance to state reopening policies. As stated on an earlier slide, there was a large population within Leon County that was hesitant to reopen despite what Governor DeSantis issued to the state. And the third being the balancing of political pressures with administrative priorities. My proposed policies. The proposed policies that I'm providing cover 4 different areas. The first being local government support for safe business operations. The second would be grants for health protocol implementation, meaning that the local government, Leon County, should take on some of the financial burden of implementing these new health guidelines for the customers of these businesses. The third would be the expansion of outdoor dining and public spaces to better equip these businesses to serve customers. And the fourth being the enhancement of contact tracing and testing programs in order to have a clear picture of where the initial infection happened to prevent that happening in the future. In conclusion, Leon County's response showcased the complexities of federalism and local autonomy. We also saw the importance of balancing public health, social justice, and economic recovery. And lastly, the lessons learned for future crises need to include collaboration and equity. With my whole heart, I truly believe and hope that Leon County continues to enact thoughtful policymaking in future emergencies.